Hello and welcome to my talk today on GIQuest and how it can be used in practice to help support the diagnosis and monitoring of gastrointestinal inflammation. Today we're going to focus initially on what faecal calprotectin is and why it's a biomarker of use in veterinary medicine, how GIQuest was created and validated, and how to use it in practice and integrate it into our diagnostic workflows. So firstly, what do we mean when we say biomarker? A biomarker is a measurable biological parameter that's an indicator of particular physiological state. They can be used to show normal or pathological states, as well as measure responses to treatments or interventions. They're classified into various types, such as molecular, so DNA, proteins or metabolites, histologic biomarkers for grading and staging of neoplasia, and physiologic biomarkers, so blood pressure, heart rate or temperature. You'll already be using many biomarkers in practice. For example, in heart disease with proBNP and troponin, in kidney disease with specific gravity, creatinine, urea and SDMA. This is a really continually evolving and expanding area which is pushing veterinary medicine forward. As we'll be speaking about gastrointestinal inflammation and chronic enteropathies mainly today, you'll see on here some biomarkers that relate to chronic enteropathy. Some of them are used in general practice, such as serum cobalamin and folate, and some biomarkers you may see being used more in research settings, so the fecal dysbiosis index, C-reactive protein, MMA, and fecal calprotectin. Some of these are being used increasingly in practice, and we can see them coming over from that research setting. Today, of that vast array of biomarkers, we're going to focus in on calprotectin specifically. Calprotectin is a calcium and zinc binding complex which is produced by myeloid cells, primarily by neutrophils. During inflammation, the innate and adaptive immune responses are stimulated, which results in an influx of phagocytic cells and the release of inflammatory cytokines. These then chemo-attract neutrophils, which trigger a cascade of events leading to those neutrophils' disintegration. Around 60% of neutrophil cytosol is made up from calprotectin, so with that disintegration comes its release into surrounding tissues. It can be released into the bloodstream and so found in serum, or if the inflammation is specifically gastrointestinal, it's released into the gut lining and lumen where it enters the fecal stream. A lot of research papers compare serum and fecal calprotectin as a biomarker, which I'll go into in a minute, but I just want to highlight a few differences between them to show why fecal calprotectin is a more reliable biomarker. As I mentioned, serum calprotectin is more of a sign of systemic inflammation because, of course, by being released into the blood, you don't know where it's coming from. With fecal calprotectin, it's much more local as the inflammation is specifically in the GI tract. Therefore, fecal calprotectin levels directly correlate with neutrophilic activity in the GI tract. Fecal calprotectin is resistant to bacterial breakdown and is stable in feces, which really helps with a biomarker, especially when owners take a few days to get the sample into practice. And it's also the biomarker that's used in human medicine for conditions such as IBS and Crohn's disease. As we've discussed, fecal calprotectin is a sign of gastrointestinal inflammation, so it could be raised by various diseases that affect the gut, such as chronic enteropathies, food-responsive enteropathy, neoplasia, and dysbiosis. There are more and more papers coming out researching fecal calprotectin, so I've just put a summary of a few canine and feline papers to highlight what's been found so far, starting with canine. It's been found that with fecal calprotectin, it's increased in dogs with IBD, or what we would now refer to as chronic enteropathy. I'm going to flip between those two terms depending on what the specific research called it at the time, and also with chronic diarrhea. The concentration is significantly decreased after treatment, as you can see really nice and clearly here on the graph. And it's also been found that it correlates with clinical disease activity. Conversely, serum calprotectin has conflicting evidence, with some older papers showing it was increased compared to controls, but newer papers showing minimal difference and no decrease in response to treatment. Interestingly, the same findings also have been described in human patients, where fecal calprotectin has been used as a non-invasive biomarker to monitor clinical disease severity and also to differentiate active and quiescent Crohn's disease in adults and children. In humans, serum calprotectin seems to correlate a little more than in animals with disease state, but fecal calprotectin was still found to be a better discriminating marker for the differentiation of IBD from controls. In cats with chronic enteropathies, response to treatment generally is based on evaluation of clinical activity. Because repeated endoscopies and histopathological evaluations are pretty unrealistic in clinical practice, biological markers that are able to indirectly evaluate GI pathology are really useful. Interestingly, despite feline chronic enteropathy inflammation usually being predominantly lymphocytic in cats, and so not neutrophilic, they still found fecal calprotectin to be significantly increased versus controls. It was also found to significantly decrease during treatment, which we can see in the graph here again. But so far, unfortunately, it has not been found to be able to differentiate between chronic enteropathy and small cell gastrointestinal lymphoma. This finding may be because chronic inflammatory enteropathy and small cell gastrointestinal lymphoma represent different stages of the same condition. And so because small cell gastrointestinal lymphoma is a disease process of chronic enteropathy, instead of being distinct diseases, we may not be able to differentiate them. Another possible explanation could be that in both conditions, the predominant inflammatory cells that infiltrate the mucosa are lymphocytes, and so the secretion of calprotectin could be equally influenced in both conditions. There is more research going on in this area, so do keep an eye out for that. In contrast to fecal calprotectin concentrations, serum calprotectin concentrations didn't differ between cats with chronic enteropathy and healthy control cats at baseline, and it also didn't decrease in response to treatment in cats with chronic enteropathy. In humans, it's been found that although calprotectin is found in various bodily fluids, the concentration in feces is 6 times higher than in blood in healthy humans, which may be one of the reasons why serum calprotectin concentration doesn't appear to be a good biomarker for cats with chronic enteropathy compared with fecal calprotectin. So now we know about fecal calprotectin and its ability to act as a biomarker, I want to introduce you to GIQuest, Caris Animal Health's point of care faecal calprotectin lateral flow test. Firstly, a little bit about Caris Animal Health, as you may not have heard about us before. We were founded in 2017, and since then we've been researching and developing products within the veterinary space, primarily in point-of-care diagnostics and antibiotic alternatives. GIQuest is the first product out of this pipeline. As an insight into how GIQuest was created, as I mentioned before, faecal calprotectin is already being used as a point-of-care test in humans and is recommended in the NICE guidelines. It's used to help distinguish between IBD and non-inflammatory conditions, as well as to monitor at intervals to predict flares to try and prevent more serious interventions. In veterinary, faecal calprotectin was being used in research settings, and there were reference labs which were being used for this research, but there was no point-of-care assay for use in general practice. Now, creating this was a little more complex than it would initially seem, as calprotectin is a protein that can exist in several slightly different structural forms, and it can also clump together into larger structures. So when we're developing an antibody-based test, like a lateral flow, to measure calprotectin, our research and development team had to ensure the antibodies latch onto the right version of the protein and not to other forms that might confuse the results. In order to do this and create the lateral flow test, our researchers used canine DNA sequences that encode calprotectin and created recombinant, so lab-grown, versions of those proteins. Those are then used to make antibodies that recognize specifically this canine calprotectin, and this approach reduces the cross-reactivity with other more distant species. The way our lateral flow test works is via a sandwich assay, in which there's an antibody that recognizes and captures one part of the calprotectin complex when the sample's added, and it fixes it into position. There's also a detection antibody that recognizes a different part of the complex and attaches to that bound antigen. The antibody is labeled and produces a visible signal. In this case, it's a coloured line that has a variation in colour depending on the concentration of the antigen, so the calprotectin. You can see here that, interestingly, in species comparisons, dogs and cats have much higher sequence similarity than either species do with humans. So dogs and cats are around 95%, but both of those species with humans only have about a 70% similarity. And that's why our test can be used in both dogs and cats, despite it only being the canine calprotectin antigen, but why we can't use human tests in either of these species. So once GIQuest had been developed, it was really important for us to validate it, which we did alongside Bristol University with Dr. Tristan Kogan, Helen Hauschel, and Christina Maunder. Our objectives were to establish a cutoff for dogs and cats between normal and inflammatory enteropathy, as well as determine whether the test could be useful in identifying dogs with adverse GI reactions to NSAIDs, whether it would be increased in dogs with carcinomas, and also to monitor response to a diet trial. So firstly, in a cohort of 50 dogs with no history of chronic or recent acute GI disease, and 50 with histologically verified inflammatory enteropathy, there was a significant pattern of the control dogs clustering at the lower faecal calprotectin end, which is exactly what we would expect. The team at Bristol University then used some very fancy, confusing statistics to confirm that this separation is statistically significant, which validated the test's discriminatory ability. A threshold of 3 on the GIQuest test, which is equivalent to 3 mg per kg, provides a robust diagnostic cutoff for identifying inflammatory enteropathy with a specificity of 96% and sensitivity of 94%. So really high sensitivity and specificity. That then showed that GIQuest is a really useful tool to identify and monitor GI inflammation. Now, as I've said, in human medicine, calprotectin is used to evaluate treatment response, anticipate relapses, and avoid repeated endoscopy. And we can use those same principles in veterinary practice. We can reinforce owner confidence and compliance with these objective biomarker trends. We can detect changes early, even sometimes before signs reoccur. And we can support long-term management with minimal stress to the patient and to the client as well. So now we knew where the cutoff was, we could put this into practice with other conditions. The next condition was food responsive enteropathy. So 20 dogs with a diagnosed food sensitivity were tested before and after going on a modified diet. As you can see, much as we would expect, all 20 had a positive fecal calprotectin test prior to the diet trial, so were 3 or over on GIQuest. But only 5 were still positive afterwards, showing the use of calprotectin as a biomarker to monitor therapeutic response. Here are those same dogs individually split out, and you can see 100% of them had a decrease in their fecal calprotectin score, with 75% of them falling within the normal and borderline range. The pre-diet mean score was 4.7, and the post-diet mean score was 1.7, confirming that intestinal inflammation subsides following effective dietary intervention. Now, I just want to draw your attention to the line of the number 15. And we can see here that this dog started at a GIQuest score of 9 before this diet trial. They then, after the diet trial, were on a level 4. Now, yes, that is still high, that is still abnormal. But if we're saying, actually, we've gone from a 9 to a 4, that's a huge improvement. We're definitely on the right pathway. This can really help with our communication with clients to be able to show them if, for example, we need to, as we very commonly do in food responsive enteropathies, if we need to maybe try a second diet, or maybe if we say, actually, that inflammation was so high, maybe we just need a little bit more time and we'll retest in a month before deciding whether to go on to that second diet. It just really helps with our communication with clients because we can show we are on the right track. We have had a huge improvement. It's just that we started so high. So that's how we can utilize GIQuest in being able to show clients and also to be able to sort of guide our next steps. The same with the one just on the line below, so on sort of the equivalent of 14. We can see we started at a 6, so still quite a high GIQuest score, but they finished at a 0. So on that case, I would think absolutely fantastic. Let's continue with this diet. It's completely effective and fully treating the condition. So it's a really nice way to be able to guide our next steps and know how to communicate with owners. So it is a useful tool for supporting diet trials or medication reviews, and it can help identify cases that would benefit from a diet trial, but also confirm response or potentially sometimes partial response or no response to dietary intervention. And it can really help support long-term management. Now, GIQuest has not yet been tested in cases of cutaneous adverse food reactions, but future studies are planned to evaluate its potential for assessing the level of gastrointestinal inflammation in this condition, and also whether it can help differentiate it from primary dermatological disease. But as I said, we've not done it yet, so watch this space. The next group tested were 20 dogs before and after a 2-week course of NSAIDs. It was primarily, I think, 18 or 19 of them were on meloxicam. No dogs scored a 3 or over prior to treatment, but 2 were a level 2, so classed as borderline. After 2 weeks, 5 dogs tested positive for GI inflammation. Again, here we can see those same dogs split out, and as you can see, 5 had no change. So those, I would say, amazing, let's carry on with the current medication. I don't foresee problems occurring. A couple of them did increase marginally, so maybe we want to keep an eye on those, and maybe, retest in 6 months at their normal NSAIDs checkup. But 5 of them did go over that limit. And again, it's how do we interpret these? The one that's gone from 2 to 3, that is still over the limit, but it's just a 1 kind of level increase, versus that dog that's on the line of 10, started at a 0 and went to 4, so very much within the inflammatory enteropathy arena after just those 2 weeks. Now, that's a dog that I would be much more concerned about and be thinking, okay, do we need to have a discussion about potentially a more gastroprotective NSAID, or a one with a shorter half-life, for example? Of course, we would need to have a washout period between using them. Or do we need to think of gastroprotectants? Again, with care, we know that using omeprazole with some NSAIDs can actually worsen the gastrointestinal effects. But again, the whole key thing here is that we can discuss this really clearly with an owner. We can very clearly say to them, we started at a 0 and we've gone up to a 4. That's quite a large increase in just 2 weeks, even if we're not seeing clinical signs. And that's why I'm recommending these alterations to our protocol. We would never suggest just taking them off an NSAID. They've been put on them for a reason, and the majority of the time that reason is analgesia. So it's really important, and NSAIDs are incredible at analgesia. It's just that sometimes we might need to try a different one to make sure that we're not getting such adverse GI effects. But again, this is what's going to help us really communicate it very clearly and effectively with clients. So we can use GIQuest for pre and post NSAID treatment, and also monitoring NSAID treatment. We do often every 6 months, we're doing a urinalysis and blood test for obviously mainly looking at the kidneys when animals are on NSAIDs, but we're not doing anything to check their GI tracts. And a 2021 study reported that 83% of dogs on long-term NSAIDs had either gastric or small intestinal erosions. So it's really important that we're checking this. Fecal calprotectin results can then help explain the presence and significance of GI inflammation to owners in a really clear and accessible way. It can provide a marker of progress when we're monitoring the response. And as I said, it can really help us determine, do we want to alter the protocol? Do we want to add gastroprotectants? Do we just want to monitor them more closely? But it allows that conversation to be opened up and had with the client. And the final canine group was 20 dogs with carcinomas, and this showed that none of them were within the normal range. Now, to differentiate between carcinoma and inflammatory enteropathy, we would still need histology, but this shows that it could be used as a really useful screening tool in these cases. And let's not forget cats. We did validate GIQuest in cats just to ensure it was as effective as in dogs. And we had really similar results to dogs, as we would expect, considering what I mentioned earlier about dogs and cats having a high sequence similarity with their calprotectin. There were 50 control cats and 50 cats which had been diagnosed by a specialist in feline internal medicine. And as you can see, the control group clustered around the lower end again, and actually even more so in cats than in dogs. Again, the team used their statistical method to identify the optimal cutoff for the threshold, which in cats is 2, as opposed to 3 in dogs. The 2 on GIQuest is equivocal to 2.5 mg/kg. And this cutoff gives a 100% specificity and 92% sensitivity. So again, really, really high, especially for a lateral flow test. So the study conclusions were that based on a threshold score of 3 as inflammatory enteropathy and 2 as borderline, 1 or below as negative, the test has a 94% sensitivity and 96% specificity in dogs. It can be used as an indicator for inflammatory enteropathy because it correlates really well with histological observation. It can be used to identify dogs that have an adverse inflammatory GI reaction to NSAIDs. It can be used as a screening test for carcinoma. And it also can be used in identifying a positive therapeutic response to modified diets in dogs with food responsive enteropathy. And in cats with a score of 2 as inflammatory enteropathy and 1 as borderline, the test has a 92% sensitivity and 100% specificity, which means the test is highly effective in differentiating cats with inflammatory enteropathy from healthy cats. So why would we use GIQuest in practice? As we've seen, it's been clinically validated by the University of Bristol and has a very high sensitivity and specificity. It gives us really fast results at point of care. Within the actual test takes 15 minutes to run, so you can do the whole thing within 18 to 20 minutes. It's cost effective, so it's £25 per test to practice. So obviously very much depends on whether what your practice markup is, but most are selling it at £50 to £60 to the owner. It's non-invasive, it's really stress-free for patients, and it really helps aid workflow. We've actually had quite a lot of vets saying that they will get those owners who sort of, maybe it's the second appointment and we know we're going to need to start doing some testing, or maybe they're just maybe harder to convince that something's going on. They bring the fecal sample in just prior to the appointment and they can run it and start that appointment already knowing whether there's inflammation or not and having that objective number that they can discuss with them. It supports clinical decision making, as I've discussed, and it helps monitor treatment response. Just to go through a little bit, just briefly, how to run the test. It's really simple. We just have the test tube, which has a stick attached to one end, which when you unscrew it, the whole thing comes out. And you just pop that end. There's two tiny little grooves in the end of the stick, which is all that needs to be filled. It's a really small amount of stool that's needed. And in fact, we've had quite a lot of vets say that if they're doing a rectal anyway, they just use what's left on the glove, and they're able to run the test from that. So once you've filled those little grooves, you replace it into the tube and you give it a shake for a couple of minutes to react with the reagent. You then take the red cap off at the bottom, discard the first drop, give it a wipe, and then pop 2 drops into the lateral flow test and just leave it on the side for 15 minutes. You then can read the results, which is really nice and simple. You have a control line and a test line, and you have a scorecard in the box, which has a gradient of colour, which correlates with the reading. So you use the colour and you just match it with the test line, the line which is the closest in colour, and you read across to the number. And that number is your GIQuest score. As I've already said, 3 and above for dogs is inflammatory enteropathy with increasing levels of inflammation as the number increases. And then with cats, it's exactly the same method of reading. It's just that in cats, it's a level 2 or above, which is positive for inflammation. Just finally, I want to go through a couple of clinical scenarios with you, just to get us thinking about when and how we would use GIQuest in practice, because this test isn't a test that we will dictate where to use it. It can be used at different points of the diagnostic kind of process, and I think that's something that's really exciting about this test. So of course we can use it when we have chronic gastrointestinal signs. It helps screen for GI inflammation and it helps inform our next steps. If an owner declines diagnostics, whether it's due to their worry for invasiveness or financial concerns, it provides objective data to help guide empirical therapy and monitor the response to that therapy. We can monitor response to food responsive enteropathies as well as various treatments for different chronic enteropathies. And we can also monitor that GI inflammation associated sometimes with oral NSAID use. As I've said, I really think the most important thing with GIQuest is the fact that we can help build client understanding and compliance. We've all had those clients who come in and say, oh, that's just them. They've always had a funny tummy, or they always have diarrhea a couple of times a month. That's normal for them. And we really want to be able to show them this isn't normal. And this is a really good way to do that. The fact that it's an objective number and it takes it away from being what they see as subjective opinion really helps with that compliance to the next steps, whether that's then joining a diagnostic process. So maybe they just needed to see there was inflammation to agree to bloods or an ultrasound, for example. Or maybe they just want to try empirical therapy, but it just gets them on board with that. It also really helps with financial barriers. Now, diagnostics and investigations for gastrointestinal diseases can be expensive. They can be costly, and I think that we need to consider that just because people can't afford, maybe a biopsy, for example, or an ultrasound, it doesn't mean they don't want to do any testing. And I think that's the nice thing with GIQuest, is that it's very affordable, especially in comparison to some of these more complex diagnostics. And sort of leading on from that financial barriers discussion, I think we can really use GIQuest in contextualized care. This is a really important area of veterinary medicine, especially nowadays when we've got less insurance around and people are facing a cost of living crisis. These are things we need to think about. If owners have limited finances or they're concerned about invasive testing, it really can be that affordable point of care option, and it can reduce our reliance on those maybe more costly or invasive procedures. As I said, if they're reluctant to pursue diagnostics, it helps provide that immediate objective evidence of gut inflammation and helps them get on board with that diagnostic process. It also helps with those communication challenges. I think sometimes with gastrointestinal inflammation, it's quite difficult to explain it to owners, and we often are having to do multiple steps in our diagnostic sort of flow, and we're often having to trial different treatments or different diets. And I think, when we've only got 15 minutes each time we see the client to discuss things, this can be a really difficult thing for us to discuss effectively with clients, and they can often be left feeling frustrated that they don't understand why we're changing. To them it might be we're changing our mind all the time, or we're not really sure what we're looking for. So I think it's really helpful for that, because we can very clearly say we started at a 6, our aim is to get 1 or below. And it also helps us become a team with that client, that we're both looking to go towards that number 1. And if, for example, we try a treatment and it goes from a 6 to a 4, it's very clear to the client that we've made an improvement, we're just not fully there yet. So it really helps with those communication challenges. And then finally, cases where owners want reassurance. We have a lot of cases coming in who maybe their dog has had IBD before, and they come in and they say they're showing those super subtle signs that only an owner would pick up, and I really feel like they're about to go into another flare-up. We do that clinical examination and nothing comes up at all that's abnormal. But that give it 1 or 2 weeks, that dog will come in with a full-blown flare-up of IBD, and that owner might think that you've missed it. It's just that they have picked up on signs because they've seen it happen so many times. So again, this helps with an objective marker that can help owners feel really confident in our diagnostic or treatment plan. And as I said before, in humans it is used to pick up a flare-up prior to the clinical signs. So we can start using that in veterinary as well. Thank you so much for listening. I hope that was really helpful in understanding how you can integrate GIQuest and faecal calprotectin into practice. If you want any more information, please go to our website or send us an email. And here are the references.